Hi, my name is Lisa Benest. I'm a board-certified dermatologist and my practice is in Burbank, California. I've been in practice for over 15 years and my focus is on general dermatology as well as skin cancer surgery. I like to incorporate as much nutritional advice and approach into my practice of dermatology, including acne. I find that sticking to more of a low glycemic index diet will help with acne. The high glycemic foods produce more inflammation in the body, so that's going to in turn show up in all organs, including the skin. And for some people that are prone to acne, they're going to see an increase in acne. I have one patient who I've been treating his acne for a while, talking to him about diet, and he was resistant to changing his diet until he got braces, and the orthodontist said you can't have sodas, you can't have sugar, and he cut all that out of his diet and he came back with a big smile on his face because his acne was just about cleared. For acne, there's not one particular vitamin that we know of which can help reduce acne. In general, I like for my patients to have a broad diet with plenty of fruits and vegetables, but there is a homeopathic pill that can be added to the acne regimen that I might give my patients, and that's the Loma Lux Acne Pill. I find that helps the body to fight off acne on its own. So it's a real boost to the regimen that I might give to my patients. There are a variety of acne triggers. I find that the most common trigger is really the teenage years, if you can call it a trigger. What happens is the hormones change, and part of that change creates a stickiness of the cells in the pores, and so the pores get blocked and the oil backs up behind the blockage. Bacteria come in and feed on the oil and multiply, and then you get the large pustule underneath. But we have to also look deeper than that, because why is it that some teens get acne and others don't? It could be hereditary. I do believe a lot of the factors are dietary. We look at the typical teenage diet and it's very high carbohydrate based, a very processed diet. Sodas, a lot of milk, that sort of thing. So I do find that diet plays a role, and if we can get some of these teenage patients to reduce their sugar and their processed food in the diets, they will have some relief in the acne. The other common trigger for acne I find is stress, and this affects the hormone cascade of the body, creating some of the more acne-producing hormones, and then we see breakouts during more stressful periods in one's life. For women, the hormonal cycle can be a very big trigger. So many women flare right around their time of their menses, and if we can help them balance those hormones through the use of sometimes herbs or supplements that support the body's hormonal system, that can assist as well. There are certain pharmaceutical drugs that are known to create acne. Some of the seizure medicines or the ADHD medicines can promote acne, and we would have to work with those prescribing doctors to help our patients manage their acne. More and more I'm finding that my patients are looking for a less pharmaceutical-based approach. At least they don't want to be stuck taking oral antibiotics for months or even years. They may not want to go to something as strong as the vitamin A-based isotretinoin. And they're looking for alternative options. So we try and incorporate some of the creams we might recommend with a more nutritional approach, and certainly Loma Lux fits right in there. Our patients are very responsive to the idea of taking a homeopathic pill that could help them overcome their acne flares and their chronic acne. I've been using Loma Lux Acne Pills for approximately 15 years. That says something right there. Our patients are happy. With any regimen you're going to recommend, you're not going to get 100% success, but I feel that Loma Lux works well and works well in enough patients to continue to recommend it.